show is about us as leaders of Nigeria and leaders of the world. We're global leaders. We're leaders in our environment, and we have duties and responsibilities that we must live up to. It's not a choice. It's a responsibility. And today we're talking about something that has been on everyone's lips for the past few weeks, couple of months now, starting from last year, early December. And it's not going to go away anytime soon because there have been lots of cancellations around the world, flight cancellations, lots of new movement from different nation states and all of that. It's COVID-19, aka coronavirus. COVID-19, what you need to know that we're talking about today. It's very timely. It's very important that as good citizens, we have a conversation around this. We talk to ourselves. What really must we know? What really must we do? Must we be spreading gist that is untrue? Or must we be sharing information that is useful to everybody? Now, did you know that Lassa fever has killed more people in Nigeria than coronavirus has, actually? And there are many more illnesses that have killed more people. Just 9 weeks into 2020, the number of recorded cases of Lassa fever in Nigeria is 810 cases and 167 deaths. 167 deaths in Nigeria. Now, I know that a lot of people are panicking about coronavirus for good reason. It's brand new. There's no cure for it. We're hearing about people dying all over the world. There's all sorts of information online, especially for those who torture yourselves with watching the news, CNN and the like, who just thrive on just churning out these horrific pieces of news, because that's what people surprisingly want to hear. Like, I think that's what obviously makes money. That's what people want to listen to. And you torture yourself. You sit in front of that screen and you keep on hearing the bad news. You want to hear bad news. Bad news abounds. And if you keep on watching that instead of focusing on, how you can protect yourself, protect your family, protect young ones, protect older people, protect people who have lower immunity, then you would obviously think that the Armageddon is about to happen. It is not about to happen, and I'm sure that is great news to everyone out there. I have a very, very, a good resource on today's show to talk about this particular issue that the World Health Organization has called a pandemic. His name is Dr Kunle Irojah, and because we've been asked to maintain social distance amongst other things, we'll be talking to him via phone, and whilst we try to connect to him, let's just go through what really is out there about the coronavirus. This pandemic has left a lot of people scampering for any and every solution. As of March 19th, there has been a total of 231,362 cases and 9,390 deaths in 177 countries. We have heard about parliamentary leaders dying, especially the case of Iran. We've heard about popular actors Tom Hanks and Idris Elba contracting the virus. We've heard about the wife of the Canadian Prime Minister contracting the virus, and lots more. But the good news for me is that many of these people that you hear about are carrying on living normal lives. I watched a video by Idris Elba on his social media handle, actually on Steve Harvey's radio show handle, and he says he's fine. He's not about to die. He's asthmatic, yet he's carrying on as normal. He would not have known that he had the virus had he not been traced to having been in contact with somebody who had the virus. The virus did originate in China, which is why our dear President Trump calls it the Chinese virus or the China virus, which is not a nice thing to say. And what it does is that it attacks the respiratory system and kills people with compromised immune systems. Since 2019, when we heard about it, it has spread really quickly across the world. And I'm sure that's why a lot of people are scared, of course, because there's no cure, there's no vaccine, and all of that. But, whilst we saw lots of people, lots of countries around the world sharing information about what needed to happen, what the citizens needed to do. We were a bit concerned because it seems like Nigeria was a bit slow on the uptake because of the erroneous information out there that, the black man cannot catch this disease. Our weather is too hot and all of that. And then, fake information going around, like the one that said that a former president of Nigeria had said it's not possible for us to get it. I even was on a flight where a young man was saying to me, oh, they say it's not back my illness, I was coming back from the UK, and he said, they say it's not black marines. I heard that these presidents, and I said, that's fake information. No, he would not speak like that. And no, we do not have proof that black men cannot catch it. And obviously, the Idris Elba situation is good proof that black men truly can catch the disease. And in Nigeria, we have 12 confirmed cases already. This is 12 confirmed cases. And this is not everybody who has it. Take note, it's not everybody who has it. And this is because testing is not easy to get to, even in our part of the world. Even outside of Nigeria. I was watching a video where a congresswoman was talking to the head of their disease control in the U.S., and she was grilling him on agreeing to give free testing to people who did not have insurance, because if they had to pay for it, it would cost as much as $1,313. How many people have that much money to pay in this world? It's very, very rare to find anybody in any part of the world who would be able to pay that much money. So it's a hard thing. So it doesn't mean that it's not ravaging our society, but we have 12 confirmed cases. Okay, that's proof that it is in our country. We actually currently have Dr. Kunle on the line, but we're having a bit of challenges getting through. So we're going to continue this conversation. So I want to remind us the numbers to call. It's 0700 923 93 93. Again, it's 0700 923 93 93. I'd like to hear from you what your thoughts are concerning COVID. If you have a tip as to how one can either avoid or manage the situation, we'll be happy to hear. But then we have Dr. Kunle on the line, Dr. Kunle Irojah on the line. Hello, Dr. Kunle.
Good evening.
Good evening, Dr. Kunle. Thank you for joining us on this very auspicious episode of the Good Citizen Radio Show. How are you today?
I'm fine, thank you very much.
Okay, glad to hear that. So rumor mongers are spreading the myth that this is the end time and all of that. What do you think? Is it end time, or is it just another virus?
Well, this will be a very mild end time. I don't want to underplay the severity of the illness.
Okay.
But at the same time, it's something that in a few months down the line, when it's finally under control, people will look back and,
wonder why we were going crazy like this.
Yes. Certainly, there's a significant risk to a portion of the population.
Mm-hmm.
Most people, not a lot of risk. However, as I'm saying that, the people who are at risk are at significant risk. And, I mean, if you are one of those people, no matter how small the risk is, it's 100% for you.
So basically, what should people do about this situation? What do you say is the difference between the coronavirus and the novel coronavirus? And before you answer that, I was reading research that said that corona, and that looked at the contagiousness, that compared the contagiousness of the coronavirus versus the average flu. And I think the flu virus, whereas the flu virus, for every 2 people, you'd have 1.3 infections. For the coronavirus, it said it was as much as, or just almost double, about 2.5. For me, that doesn't seem, I mean, it's double, but it doesn't seem like a really crazy situation like Ebola, of course. So it means that if one practiced a lot of personal hygiene. Make sure that you don't go too close to a person who is coughing or whatever. Intermittently wash your hands, clean your hands, then you should be fine. So what are your thoughts on all of these?
Okay, so this COVID-19 coronavirus illness, the most significant issue that I see with it is the fact that a lot of people can have very mild symptoms and still spread it. So that is actually where the danger lies.
And mild symptoms are what? Like, an intermittent cough or?
Like weakness, like lethargy.
Like lethargy, fatigue.
Not even a cough.
Not even a cough.
I'm just feeling a bit under the weather.
Which is why it spreads a lot more than the flu. Because if you know a person has a flu, then you avoid them when they cough or they sneeze. You knew to avoid them. And
then, of course, even something like Ebola, you wouldn't spread Ebola if you don't have a fever. So it's easy to check, everybody that has a fever, you quarantine them. Someone may not have a fever, or the fever might easily be suppressed with paracetamol, and then the person goes along and he's spreading the virus. So that's why it's important. If more aggressive steps have to be taken to control the disease, in the sense that those who are sick should not be moving around. But that requires almost like a shutdown of society, because like if you are, for instance, you yourself, you're hosting a radio show, can you just tell your boss at work that, I'm feeling a little ill, I'm not coming to work? You can't.
Right.
I'm a doctor. If I'm feeling a little heavy,
so in my case, it wouldn't be applicable because I don't have a boss, but I understand what you're saying.
Okay.
I'll tell me I'm not feeling well, and I'll be like, you know what, I need to have a lying, but then everybody would understand, right?
Yeah. If you're working in a bank, you just don't feel well, can you decide you're not coming to work? If half the workforce said that, because it could be a malaria, it could be anything.
Right.
The workforce said that, then it wouldn't make sense. But you can see in other countries, what they're doing is they're just shutting down the entire country. Everybody stays at home, they get over it, then they will restart the economy.
So before we go into other people shutting down the economy, let me just quickly tell everybody, because I didn't do that the first time. I want to assure you that Dr. Kunle Irojah is an expert in this field. He's a focused and dedicated respiratory physician committed to the philosophy that globally improved healthcare is achieved by the multiplication of individual effort, which very much ties into what we're doing here, because we think that it is us individuals that can make the difference. Now, I was going to ask you, Dr. Irojah, about, or rather, I was going to speak to what you just said about other societies shutting down, because I came back from the UK on the 10th, and I can tell you that I was a bit like a mad person, literally trying to avoid touching poles and sanitizing my hands. People were smiling at me like I was their crazy aunt on the trains, because they wondered why I was being so particular. Obviously, in Nigeria, we were already going crazy at that time. And so when I got to the UK and I saw people acting like it was normal, and, people's hearing, it's possible that this child in whatever school has the virus, and they were saying, carry on as normal, blah, blah, blah. And, I read that they were trying to do the whole human
herd immunity.
Herd immunity and all of that. But we have to take a short break while you think about how to answer that question. We'll have to take a short break on the Good Citizen Radio Show, and I'll be right back.
The Aspire Coronation Trust, ACT Foundation, is a non-profit organization established to help local, national, and regional non-profit organizations working to address the challenges and associated vulnerabilities across Africa. Our interventions are focused on 4 key areas, which are health, entrepreneurship, environment, and leadership. At ACT Foundation, we believe that together we can make a difference. So, let's come together to make the positive social impact we desire in our world.
Welcome back to the Good Citizen Radio Show, guys. I've been talking to Dr. Kunle Irojah about the COVID situation in Nigeria, what we need to know. And we have been talking about the herd immunity system that had been practiced in the UK, of course, until things seem to start to go out of hand, and how applicable it is, if that has changed, what we should be doing differently here. Dr. Irojah, please.
Yes, well, the herd immunity theory sounds good. It sounds good on paper in the sense that it seems like the thing that most people get over. That's only the most vulnerable in society that will succumb to the illness.
Absolutely.
But in the UK, for instance, they do have a very large vulnerable population. So they didn't take that into account in the initial planning. They realized by the time they've done their projections, they realized how many people could actually be vulnerable and how it would quickly overwhelm their health system. That it would be more proactive. And yes, it's difficult to say what our vulnerable population is. We're to be perfectly honest, we're not very healthy people. Malnutrition and a lot of diseases. Not as many chronic diseases as other countries because we can't really manage people very long term because of finances and so on. There's still a significant population that's old and infirm, and these are the people that are at risk. So it's something that is much better to prevent. Unfortunately, I think we've missed the boat. The prevention part, stopping people at borders, really trying to quarantine, we're not aggressive enough.
No, we're not. We're not. I came back on this flight and I had somebody sneezing and coughing on my flight. I was actually also concerned that the airline did not do anything on the flight. I thought that they should have done something to ensure that the health authorities knew about this person. And I remember that having come off the flight, I saw him literally try to go past. Of course, they did notice that he hadn't filled the form, but as they were moving him aside to ensure that he filled the form, he pretended, of course, like he didn't know that there was a form, because I'm sure he was afraid. He probably didn't have COVID, but he was concerned that they would quarantine him if. So he didn't want to fill the form, and he was trying to dodge aside. And guess what? He was shaking the hands of every immigration officer that was sat there. That was the same palm he was coughing and sneezing into. So I thought to myself, if this person had COVID-19, then definitely this is a number of people who would have spread it across. Okay? And so these are the people who are there. They were spraying sanitizers in their hands. Yes, they were shaking somebody who had just been sneezing into his palm.
Yes. So you can see that a lot of education, a lot of seriousness is lacking. People still don't really understand what we're talking about when we're talking about this disease. They just really don't understand that it's not something that we can play with. It's not something that we can do like Nigerians usually do and just, business as usual.
They thought that it would be like Ebola that literally God saved us from, literally.
Yes, but people, I guess everybody's hearing things, everybody has this thing somewhere at the back of their mind that, well, it's happening in other countries, it's not happening here, therefore it will not happen here. At the back of everybody's mind that, something is protecting us, the weather will protect us, something or the other.
Yeah.
Really true.
So we should stop relying on some supernatural force to protect us. We should do the things that we must do. So the US currently endorsed chloroquine as a treatment for COVID-19. For those, they have not.
No, they have not.
So I guess the statement is the US currently stated that they were testing for the use of chloroquine and 2 other drugs for COVID-19. Now, what has happened is I have heard that people are now overdosing or having a reaction to chloroquine. And I must confess that I was one of those who thought, you know what, let me go and stock up my medicine cabinet with chloroquine.
Let me just quickly say this about the chloroquine. Now, it is going to be completely useless outside of a hospital. Okay?
I see.
The chloroquine is not, even when it is used, so it was used in China, South Korea, when it is used for severe cases of COVID-19, cases that are like critical. If you have a mild disease, you don't need it.
Right. And if you take it?
Most people have a mild disease.
Okay. Right. So what can we do then? If we cannot take chloroquine and we cannot treat ourselves as we normally do at home in Nigeria, what do we do?
Prevent the spread.
Prevent the spread by
covering your mouth, staying at home essentially. Like if you're sick, do not go out.
Okay.
Yeah, that's the only way that we can actually contain the spread of the disease. If you're sick, if you are sick, if you have COVID-19 and you are sick and you do not encounter anybody else, you effectively have stopped transmission of the disease. Okay?
Okay.
So if everybody that is sick does not transmit it, the disease will die out.
Okay. Thank you.
Everybody is going out, and so I have to be at work. Oh, I can't have money.
Okay, thank you so much, Dr. Irojah. We'll stay safe. We will make sure that we cover our mouths. We'll make sure that we wash our hands. Thank you so much for coming on the show.
It's my pleasure.
Have a great evening. Bye-bye. Okay, guys, so you've been listening to Dr. Irojah talk about the COVID-19, aka novel coronavirus. It's not about to kill us all. According to data that I read, as much as 85% have only mild to moderate symptoms, and it typically would affect people with lower immunity. That doesn't mean that we shouldn't be concerned, because many of us have low immunity, but we can do things to protect ourselves. And just because you have low immunity doesn't mean that you're about to die from COVID-19. Now we can take calls. The number to call is 0700 923 93 93. Again, it's 0700 923 93. Hello.
Hello, good evening.
Hi, Ndidi. Good evening. How are you, Ndidi?
How are you? I'm very fine, thank you. And how are you doing?
I'm glad. I thank God that I'm glad and I'm well.
We thank God we're still coronavirus free.
There's what?
I thank God that we are all still coronavirus.
By the grace of God, may we remain so.
Amen. Amen. And I forgot to congratulate you the other day for making the top 50 inspiring women.
Oh, thank you, Ndidi. I should hire you as my PR officer.
Oh, please do.
So, Ndidi, tell us, do you have a top tip for us to use to either prevent or manage COVID-19?
Well, you see, for me, the best is that people should stop visiting other people.
Okay.
They should stop going to people's home. They should not forget anything about visiting your friend, your family. Stay in your own house. Don't visit. Just stay away from now. Let's speak on the phone, because it's better that way.
Okay.
It's better because somebody might just take it from somewhere, take it into another person's house, and goes back to the house, and the thing keeps spreading. We should all just stay in our own homes.
Okay. Thank you. Thank you.
Please, even me now, when I come in, as I'm coming in and I'm stopping, I have to take my bath. This has even gone beyond washing hands. I take my bath before I even start cooking or doing anything. That's just what I've been doing now. It's better that way, because we don't know what we might have picked along the road.
Absolutely. Thank you.
The body from head to toe.
Thanks, Ndidi. So she spoke to social distancing and washing your hands. Do we have another call? Okay, so we missed that. The number to call is 0700 923 93 93. For those of us who want to manage Ebola, coronavirus at home. Hello. Hello. Good evening.
Hello. This is calling from Unikpa.
Vincent calling from Unikpa. Right? Hello, Vincent. Can you hear me?
Yes, I can hear you. You can hear me too.
Yes, I can hear you. So, any top tip for us?
Please.
Any tip for us on how we can manage COVID-19, either to prevent or to manage it if you know anyone who may have contracted the disease?
Actually, I've not really met anybody. But I think some of the different measures that were rolled out by the government, if they are followed, it can be prevented. But the challenge is, one would have expected maybe by now.
Hello, I can hear you.
Maybe by now, maybe the government would have looked for a place out of the Yaba where they have put the disease research center. Maybe where they can build temporary shelves and maybe like China did, maybe they could get a hospital there, get doctor bed and get facilities there where they can put people for adventure or in case it goes beyond the stress that we have now.
Thank you.
Okay.
Yes, thank you, Vincent. So Vincent is suggesting that perhaps the government provides more opportunities for people to come into the hospitals to provide temporary beds and all of that. But I just also wanted to point out that even in advanced countries where they typically plan for mass health care, they have been unable to manage the influx of patients who have this ailment. And what they have advised people to do is to become reclusive, to practice social distancing, stay at home, try to avoid getting in contact with other people, manage the symptoms if they are mild to moderate. If they become chronic, then they need to come into the hospital. So we have to, there are things that I think that, that was shared recently by a nurse, and I think that people should do all the things that we need to do, social distancing, sneeze into the crook of our elbows, not touch surfaces, wash your hands. If you can't wash them at any point, sanitize, use your knuckles at elevator buttons. Don't use the pad of your fingertips. If you do all of these things and somehow something else happens, then you just need to manage yourself. What people have been stocking up on is, of course, tissues. You should get paracetamol because they say that ibuprofen is not the drug of choice. If you can get cough medicine that's mucus thinning, or while checking that you are not repeating paracetamol in it, because if there's paracetamol in it, you can't drink paracetamol again. You can buy some honey and lemon to mix yourself a potion. If in case you develop any symptoms, you mix half and half of each. Get your humidifier or Vicks Vapor Rub and make sure that you stay hydrated. With all of these things, I'm sure that we're coasting through this. I'm sure that we'll be well. Remember that our one of our partners, Ryan John, is still giving out free eyelashes, so you can still look glam whilst avoiding lash bars. All right. So just follow us at Good Citizen NG on Facebook, Twitter, and Instagram. And every morning you'll be able to win something as a result of this partnership. Thank you for listening to the Good Citizen Radio Show. I'm sure that you've learned a thing or two. The show happens every Friday at 8 p.m. on Inspiration FM. Keep the conversation coming on social media. And remember that even though this is Friday night, you have to be responsible as you go out and have a good time. Have a great week. Bye-bye. It's Bekeme.